Hi, I'm Dr. Greg Millar, and welcome to another segment of Back Talk. Today we have a question from Tracy in Huntsville who wants to know about low back pain. Where does it come from and what are the current treatment options? Thanks, Tracy, for your question. You know, 80% of people suffer from low back pain at some point in their lives. Back pain, and in particular low back pain, is the second most common reason for a visit to the doctor's office, outnumbered only by upper respiratory infections. In fact, it is estimated that low back pain affects more than half of the adult population in the United States each year. In fact, more than 10% of all people experience frequent bouts of low back pain. The susceptibility of low back pain to injury and pain is due to the fact that the low back, like the neck, is a very unstable part of the spine. Unlike the thoracic spine, which is supported and stabilized by the rib cage, this instability allows us to have a great deal of mobility, like to touch our toes or tie our shoes or pick up something from the ground. But the cost of that mobility is that increased risk of injury. As long as it is healthy and functioning correctly, the low back can withstand tremendous forces without any injury. Think of a professional weightlifter, how they can pick up several hundred pounds off the floor without injuring their low back, or football players playing in the National Football League. However, if the low back is out of adjustment just a little bit, or is weakened supporting muscles, ligaments, or tendons, something as simple as taking a bag of groceries out of the trunk of the car, picking up something off the floor, or even simply bending down to pet the dog can cause excruciating low back pain. I, for one, know it. Until recently, researchers believed that low back pain would just heal on its own. Unfortunately, we've learned that, however, that's not true. Recent studies now show us that when low back pain is not treated, it may go away temporarily, but will most likely return in the future. This is especially true if any one of the many joint capsules in and around the spine are compromised. So it is important to take low back pain seriously and seek out professional chiropractic care. This is especially true with pain that reoccurs over and over again. You know, there are many different causes of low back pain or conditions that can result in low back pain, including strained ligaments, strained muscles, herniated and bulging discs, trigger points, and inflamed joints or degenerative disc or facet disease, and many more. While sports injuries or accidents can lead to injury and pain, sometimes even the simplest movements like picking up a pencil from the floor can have painful results. We call this back attack. In addition, conditions such as arthritis or poor posture, obesity, psychological stresses, and even kidney stones, kidney infections, blood clots, or bone loss can lead to pain. Due to the fact that there are a whole lot of things that can cause low back pain, and some of those things can be quite serious if left untreated, it is absolutely important that you seek professional help. For many years now, the chiropractors of Millar Chiropractic Clinic have been treating low back pain. In fact, we kind of think of low back pain as our bread and butter. Over the years, we have successfully treated thousands of your friends and neighbors with low back pain. What do? Well, first we take a thorough history of your low back problems. You know, when it started, when is it better, and when is it worse, and how many episodes. Second, we do a complete physical exam. As we're a proud member of the UAB Department of Neurosurgery Chiropractic Care Team, we do the low back exam as taught to us by world-renowned UAB Dr. Mark Hadley, medical doctor. This is the same exam done by the UAB Department of Neurosurgery. This includes orthopedic tests, neurological tests, range of motion tests, sensory tests, muscle tests, palpation tests, you know, the touch of the low back. You cannot do this from across the room. In fact, most of our patients tell us that they've been to many doctors in the past for their low back pain, and we do the most thorough examination that they've ever had. Third, we take or order whatever x-rays or advanced imaging is necessary to aid in diagnosing and treating your problem. This often includes looking at MRIs or x-rays that you, the patient, have already completed. Next, we look at the necessity of other tests, such as nerve conduction studies or other studies. Fourth, we sit down with the patient and go over what we have found, and we call that our report of findings meeting. At that point, we can make a pretty good recommendation of the kind of treatment that we think you should have. Of course, we call that our care plan. Finally, in our report of findings, we want to answer 3 questions. Can we help you? Did you come to the right place? We also want to know or answer, how long is it going to take? And how much is it going to cost? In other words, how much does my insurance cover and what am I going to have to pay out of pocket? Call today and see why we say that we deliver the results that can change your life. Thank you.